This is case of the day, and we're on to another week. We have the 102nd case, which is titled The Three-Step Process to Diagnose IgG4 Related Disease. So, this is a 63-year-old presented with backache in Jan 20, had an MR. Retrospectively, we can see this periaortic soft tissue, which was missed at the time. Symptoms progressed through the COVID years, and then he had a CT scan sometime in 2022 that showed disease around the aorta. So he came for a PET CT. We see the periaortic soft tissue encasing the bifurcation and the proximal iliac arteries, beautifully seen on the coronal images. There was no other disease anywhere. I biopsied it at the time. It was diagnosed as idiopathic retroperitoneal fibrosis, and there were scanty IgG4 cells, but not enough to make the diagnosis. He had a CT 6 months down the line, which showed minimal improvement. And for those interested in this whole periodic soft tissue biopsies, I had just done this about 15-20 days ago, if you're interested. So anyway, he came back on Saturday with proptosis for a PET, and I'm not fully aware of what has happened in the interim. But the PET shows progression of disease, some new disease around the aorta and the IVC, and the orbital disease, which is presenting as an inflammatory pseudotumor involving the rectus muscles, but the lacrimal gland is normal, and that's important, as you will see in a minute. So this is multi-organ involvement. There's progression of retroperitoneal disease and inflammation, and there's new orbital pseudotumor. So this could all be idiopathic, some autoimmune process, or it could be IgG4 related disease. And if you remember case 87, which was titled Multiple Lung Nodules and Associated Findings, this was a multi-organ disease that on lung nodule biopsy was proven to be IgG4 related disease. But I didn't discuss IgG4 related disease in that case because it wasn't fully proven at the time, and nor is our case right now. But there is a process to making the diagnosis, and as we all know, the rheumatologists love criteria, and they want to fulfill those to make a definite diagnosis. And this is a lovely paper that captures the EULAR and the ACR criteria for making the diagnosis. So just a recap, IgG4-RD is an immune-mediated multi-organ inflammatory process, but there's infiltration with IgG4 secreting plasma cells, and so you usually get elevated levels. Multiple organs are involved, and they're listed here. And the important thing is simultaneous involvement of multiple organs. And that case 87, if you remember, had pancreatic, renal, and periaortic disease. So in the same slide, you can see 3 organs that are involved, plus there was lung involvement. So the process is 3-step. It's entry, exclusion, and scoring. Entry is whenever there is multi-organ involvement of any of these structures, dura to retroperitoneum, it should trigger in our mind the possibility of IgG4 related disease. And radiology is extremely important for this. The second is excluding conditions that can simulate IgG4 related disease. And here, so fever is not typically seen with IgG4 disease, and you have a bunch of serological criteria, radiologic criteria, etc. And they're all listed here, and it's all there in the paper as well. The third step then is to score. So if you think there is IgG4 disease and no exclusion criteria are met, then you try and score, and you need a score of above 20 to make the diagnosis, and all of that is listed out here. Now, our patient, and this is difficult because orbital disease is not listed here, but I'm just saying if you were to use it as a surrogate for lacrimal gland, you'd say one pair involved 0.6. Retroperitoneal disease, you can see here, soft tissue around the descending aorta and iliac artery is 8. So the total score is 14, which is not enough to make a definitive diagnosis, which means that the patient will likely need to either have elevated plasma levels or get a new biopsy done to see if it fits into any of these, so that we can get a score above 20. Now, we know that all of the rest is normal. There's nothing in the lungs, etc., and therefore there's no point doing any further radiologic testing. But look at the importance of radiology in making a diagnosis of IgG4 related disease. So, to summarize, IgG4 related disease is not an uncommon multi organ disease. We should think about it. The diagnosis should be triggered whenever we see simultaneous multi-organ involvement, and diagnosis involves entry, exclusion, and scoring methods. And it's a good idea to be a little aware of this and maybe keep a couple of these articles handy to look at as and when we see simultaneous multi-organ disease. That's the panel we're doing, my WhatsApp channel. Thank you so much for viewing this.